Hello. So I am Professor Katharine Barnard-Kelly, and I would like to talk to you today just for a few minutes about health inequalities and access to healthcare for people with diabetes. So it strikes me that it's been 50 years now since John Tudor Hart published his Inverse Care Law article in The Lancet, which states that the availability of good medical care tends to vary inversely with the need for it in the population served. Conversely, that those with least need of healthcare tend to use health services more and more effectively than those who are most in need. And health inequalities, they arise not only from variation in access to health services, but also in variations to the quality of healthcare from area to area. And often healthcare professionals get blamed for these inequalities. And you can see, you look at the national audit data and the national paediatric audit data here in the UK, and you can see, for example, that there are stark variations in the delivery of care processes that people with diabetes are entitled to. And also, unsurprisingly, there are stark differences in the diabetes-related outcomes that people experience across these diverse groups, which makes sense. However, the reality is that actually healthcare is unequal, not just because healthcare professionals are delivering different rates of care processes, but because there is structural inequality in healthcare systems. And that actually the environment within which healthcare professionals operate is fundamentally constrained and skewed towards healthcare inequalities. So it's really important to be mindful of this structural and persistent inequality, because healthcare professionals have to work harder to overcome it and ensure that every single one of their patients receives the care to which they are entitled. And we see that in healthcare technology, diabetes technologies, there is a big difference in access of diabetes technologies across people from different socioeconomic and ethnic minority groups. So what do I mean by structural inequality? Well, what I mean is that healthcare systems right from the very top are structurally unequal. So regulatory bodies such as NICE, for example, they require evidence in the form of randomized controlled trials and systematic reviews as the hierarchy, the best hierarchy of evidence when they are making and deciding clinical guidelines for how care is delivered within the NHS. The challenge is that the evidence that they review, when you look at these randomized controlled trials and these evidence syntheses, actually all of the participants that have taken part in that research generally come from early adopter, white, middle class, highly educated populations. They are not diverse populations in clinical research. And that continues to be a problem, not just in the UK, but around the world, that actually it's really important to include people from as diverse a group as possible to ensure that their views are reflected, but also that their experience, the way they engage with healthcare and experience healthcare, is fair. We know that decision-making committees are not representative in terms of gender, ethnicity, and socioeconomic status. So again, there's a structural bias in the way that healthcare decisions are made, funding decisions, for example, for research, clinical guidelines decisions. And we know that inequalities are endemic from the highest structures of healthcare, and that then they are disseminated throughout each level of healthcare delivery, reinforced at every point. So at the point of care, actually, these healthcare inequalities, these structural, these clinical inequalities are so ingrained in the system that they're barely noticeable on an everyday basis. But they are noticeable. They're noticeable for every individual and their family who is unable to access the care that they're entitled to or to access the technologies that may help them have improved self-management and better glycemic and mental well-being outcomes. So really, the point of today's kind of short vlog is to say, we know these healthcare inequalities exist. We know that they're structural. We know they're reinforced. But you know, what we also know is that once we are aware of them, we can address them and we can reduce these inequalities and we can deliver fair, equal healthcare to everybody, irrespective of their ethnic background, their socioeconomic status, or their education level.